Today we're going to be reacting to Nollywood Medical Scenes, and I'm going to be fact checking them and telling you is it correct, what they have done, blah blah blah. So we'll start with a bit of old Nollywood, then we'll go to some new Nollywood. I'm really excited about this, as in I can't stop smiling. Okay, well, let's just go straight into it. Hi, if you're new here, my name is Ada and I'm a medical doctor living and practicing in Nigeria. So if you want to stick around, subscribe. Let's just go straight into this video because we have so many things to look at today. So let's start the video.
100 bits.
Chalo, Godi. Chalo. Oh my god. So this doctor is a magician because how do you just do this? I don't even know what he did. He just did this and said 100 bits. Like he didn't count. He wasn't looking at his wristwatch. How do you know? How do you know it's 100 beats? So what he was trying to do was to count the pulse of the patient, which is very important. It's one of the vital signs. It can tell you if a patient is in shock and all of that. So you place your hand here, if you can see me. Place your hand here, but you have to be looking at the wristwatch to count how many beats you feel in 1 minute. So, but he just touched it and brought it down and said 100 beats. Very, as a magician stuff is happening here.
12 bits above normal.
Okay, wait, he said 12 beats above normal. That's wrong. Normal pulse rate is 60 to 100. So yes, this is on the high side of normal, but it's still normal. So that's wrong.
She has low blood.
You guys, I assume he attempted to check for pallor. The way you check for pallor, let me raise my glasses a bit, is you look under the eye, not on top, because what is going on? I see, but that's why if you're going to do medical scenes in movies, you have to get a doctor that is a consultant to tell you what to do. So this is just so embarrassing. But this is old Nollywood, so maybe new Nollywood would be better, I guess.
We have induced vomiting. It's a case of hemolysis.
Oh Jesus!
It's the cells around the cardiac region
See, this is gibberish.
have ruptured.
He said we've induced vomiting. There's hemolysis. The cells are ruptured. Around the hearts are ruptured. What are you talking about? This is nonsense. It does not mean anything. Thank you. Because I don't know what he's trying to say. Hemolysis is breakdown of cells. Okay? So in a sense, when cells break down, they rupture. But saying the cells around the heart to mean hemolysis is a lie. And then what has that got to do with vomiting? I have no idea. So we're done with this clip. So let's move on to the next one. Like, okay, the second video. No, wait, we have to play it again because I think what is happening here is resuscitation. Okay? If someone is actually dying, the most important thing is not this thing they are squeezing on his nose. The most important thing is cardiac compressions. That's the most important part of CPR, which is cardiopulmonary resuscitation. Resuscitation is an English word. Cardio is the heart. Pulmonary means the lungs. So you're trying to use your hands to do the work of the heart and pump blood into the rest of the body. The most important being the brain, because within 5 minutes the brain is dead and the person cannot come back. So the nurse is just pressing the thing and looking at the boy. I don't know what is happening here. Then the relatives are just standing around. Oh God, oh God, oh God, oh God, oh wow. Okay, it's like the person that I got this video from said no be smarting, as in no be really smarting because what? Okay, let's just move on to the next one, Makania. Oh my God.
How are you?
What's that dramatic sound like? Shoo. Okay.
Doctor, please.
What is her chance? How bad is her case?
Her case is very, very bad. It has affected her two legs.
Hey, hell. Okay, number one, you as a doctor, you walk into a room. Maybe I didn't watch the full movie. So someone just says, how bad is her case? And you start talking. Ethically is wrong. You first of all have to find out who that person standing there is to the patient so that you don't give out information that the patient does not want to somewhere that they don't want to hear it. For example, someone has HIV and you go and tell the neighbor. It might not be the best thing. You get so you have to find out you that you're asking, who are you to her? Secondly, you cannot just say her case is very bad. What if, as you say, the man's response is to give you one big slap? What are you going to do? Part of our exams as medical students is how to deliver bad news. You have to be, of course, the skill grows with practice, but you cannot just say your case is very bad, it has affected her two legs. You never tell the person sit down, we need to talk, or come into my office or something. You just may porn. Hey, Jesus Christ. Her case is very bad. Okay.
And she may not be able to use it again for the rest of her life.
I really don't understand, doctor. Make me understand. Are you trying to tell me that she won't be able to use her legs again?
Yes, she will not be able to use her leg again. She can't walk with it again.
Oh my God. Doctor, just make this clear for me. Do you mean to tell me that she's going to be crippled for life? She won't walk again?
Most probably.
Oh my God.
Most probably.
You see doctor's face for me. But he said, most probably. No, this is not the best way. There are people who do this because in a hurry or something like that, but this is really not the best thing at all. You can't be doing this. You can't be delivering bad news like this. You're probably, I don't know who this person is to the man, but maybe his wife or his girlfriend or his fiance, and you're probably just telling him, bam, she's not going to work again. She's going to be crippled, blah 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 blah. Just like that. Abba. No, no.
Oh my God. All right, doctor. What about the pregnancy? How's the baby?
We are sorry, she lost it.
Afonia has to be bad news doctor. Everything bad, everything bad. You see, what if the man fainted? Then you have another emergency on hand. Like, make it make sense. I don't know, but you can't know. I don't know. This thing is just not realistic, please. So let's just move on to the last clip. I think that's the last clip that we're going to be doing today. This one I'm really excited about because this is the definition of New Hollywood. This is Clinically Speaking, a show that is here on YouTube. You should check it out. I think it's good.
And now we go.
She fainted at work, bumped her head, and has been going in and out of consciousness.
How long?
40 minutes. We would have been here on time, but a tanker fell on the way and there's been a lot of traffic.
Ma'am, I need you to breathe. Just focus.
Okay, yeah, first of all, this is nice, okay, but this is not the Nigerian reality. I think this is a bit of a copy of what happens abroad because we don't have, what are they called? EMTs, like people who bring in patients from trauma centers and all of that, that can give you history as they are coming in. This is something that's what we want the Nigerian system to become eventually, but we don't have this right now. Maybe in places like Lagos, because I know in Lagos they have air ambulance, but in most places in Nigeria, this is not how patients are brought in. Patients are usually brought in by their relatives. Okay, sometimes if it's like an accident or something, maybe police or road safety will accompany them, or somebody telling you, oh, it's going in and out of consciousness, blah blah blah, give you medical history. It's a lie. It does not happen like that in Nigeria. Well, yeah, it's something we aspire to do.
Your breathing. Can you hear me? Ma'am, can you hear me? Take deep breaths. Just focus on me, huh? You're in good hands. Ma'am, just take deep breaths. Deep breaths. What? Ma'am, stop.
So first of all, what he was listening to, I don't know what he was listening to. Was he listening to the heart, or was he listening to the breathing? Of course, the ABC of resuscitation is you check the airway. So when he's saying, "Ma'am, can you hear me? Can you hear me?" If the person responds, you know that the airway is clear. You check the breathing, you check the circulation. So he just kept on putting his stethoscope. The next thing is a heart stop. Gang, gang, gang. So let's see what is going to happen next. Okay, first of all, I'm so happy that they are doing chest cardiac compression. That's the right thing. If the heart stops, that's what you should do. But where they are doing it's supposed to be on the hard surface. This patient is still on the bed. Then that it's not that dramatic. Oh. It doesn't happen like that. When the person comes back, they don't do and come back. It doesn't happen like that. It's not that dramatic.
Okay, let's get into the
According to the ECG, your heart is failing. Do you know him?
Yes, he's my brother, Omar.
You see that thing I talked about previously? Like someone rushes in to be with a patient. You have to ask, who are you? You don't just open your mouth, blah, 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 and just be talking. Now, back to something that he said, according to the ECG, your heart is failing. ECG cannot tell you heart is failing. If you had said echocardiography, I would agree with you. ECG can give you pointers that the heart is failing, but you cannot be sure that someone's heart is failing with an ECG. That's not very correct. But so far, I think this is the most accurate of the words that received. The other words, I don't really understand what was happening.
Oh, hello, sir. I'm Dr. Chooks. This is Dr. Koga and Dr. Olani. I was just telling your sister that her heart is failing.
Okay, a step further. What I would usually do if there's someone standing with a patient and I want to talk to the person about their condition, I just tell the person, just take a walk, just a little walk. Then I'll ask the person, do you want this person to be here for this conversation? And when they give their go ahead, I tell the person, okay, you can come back. I tell the relative, you can come back. Even if he's saying it's your brother, I don't know your relationship with your brother. So I can't just open my mouth wham because of litigation. So that's the right thing. You should be sure that the patient is comfortable with the person being there when you pass the information. Usually people that are sick like this would want a relative to provide them some succor when you're giving them news like this sharp. But yeah, it's just that we have to be extra careful.
Is she dying?
No, not quite.
Well, she's experiencing a mitral regurgitation. What that means is that the blood is flowing back up into her heart because the mitral valve is not closing properly.
What does that even mean?
Exactly my response. As in, when you're trying to counsel people, when you're trying to explain medical stuff to them, you have to use simple language, something that the layman can understand. You're telling me, oh, he has mitral regurgitation. It means nothing to me. So my response will be, what does that mean?
Mitral valve is one of the valves of the heart that prevent the backflow of blood into the heart. Now, it being damaged means blood is not going to get to the other tissues of the body. So it can cause intense tiredness, breathlessness, stuff like that.
I don't still understand. What does it mean?
Exactly. I don't understand either. She was very fast. So yeah, but it's fine. At least they are trying. They are trying to explain.
Don't worry, it's treatable, okay? We just need to run some tests to make sure it's what we're thinking it is.
Tests?
Yeah.
How long will that take?
It shouldn't take too long.
Okay, ma'am, do you have a history of heart diseases or have you experienced any stress trauma recently? Let's say a car accident, perchance?
No.
Okay. Are you on negrotimin? It is used to treat migraines.
No, doctor.
Okay, well, the history of heart disease is something you should ask. Accidents. The drug. There are so many drugs that can give you heart diseases. This particular one used to treat migraine. I honestly didn't hear the name of the drug that he called, but that one wouldn't be the first for me to ask if I'm thinking that somebody's heart is failing, like they said, but it is what it is.
Okay, ma'am. Listen, a nurse will assist you with the tests and we will see you shortly.
Thank you, doctor.
Then I want to ask, if her heart is the problem, what does she have bandage on her head? Because the heart is here, the head is here. Why? Okay. No, I'm just saying. Maybe the bandage is like to help us viewers to know that she's not feeling fine, but seriously, it's so unnecessary.
Thank you. You should be fine.
So, you have something called rheumatic fever. We'll put you on some antibiotics to treat it.
Thank God.
But unfortunately, the damage to your mitral valve has already been done. However, we don't know how bad it is, so we might be able to put you on some drugs to manage the effects.
Okay, so ma'am, what we're going to do is we're going to take an X-ray of your chest, and then we'll do a cardiac MRI.
So the parts where you have rheumatic fever, it has damaged your mitral valve, all correct until the point where they said you do an X-ray. So yes, if someone has heart failure, that's one of the things you do. Then they jumped to cardiac MRI. That was quite the jump. You've not done an echocardiography, which is an ultrasound of this chest. That will give you a lot. You are moving to cardiac MRI. Like, that's putting the cart before the horse. Okay, no. But so far they try. Yeah, all in all, I think this last clip they tried, they did research and it was showing that there was research. Well, the other ones, let me not say. But it means that New Nollywood is doing research, even though it's not perfect. Okay, but it's a step in the right direction. And I really like their bedside manners, like how they try to reassure the patients, try to also explain that they don't know the extent of the damage. They would give her more information when they have more information. That's very good. That's very commendable. So did you enjoy this? What do you think? What do you think? Should we do more of this? Tell me in the comment section. If you enjoyed this video, leave a like. Subscribe to join the family if you haven't, because why haven't you? What's the issue? What's the problem? Tell us. Let us make a diagnosis. Okay, thank you so much for watching. As always, stay healthy, and I hope you had fun watching this. Stay healthy, and I will see you in the next video. Bye.